everyone, welcome back to Global Nurse Stories. It's me again, Blessing. Thank you for the likes, thank you for sharing, and thank you for your comments on my previous videos. Today, I have a very important topic to discuss, and that is how to create a study plan for the NCLEX examination. Let's go there. So I know people have different timelines to write their exam depending on your ATT validity, depending on how much time you have in your hands. But for the sake of this video, I'm just going to make 6 weeks study plan. You can adjust it to suit yourself. If you have more time, you can spread it out. If you have less time, you can reduce it. So before I start, if you are a return subscriber, thank you. Don't forget to hit that notification button so that whenever I post a new video, you'll be notified. And if this is your first time watching Global Nurse Story, please don't forget to subscribe. Yeah, so before I go to the weekly plan, 6-week plan to study, there's some preparatory phase. There's some preparation that needs to be made even before the 6 week starts. And I'll go straight to tell you what to do. So what is the first thing to do? The first thing to do is for you to choose your study material. In preparation for testing for NCLEX exam, you have to know which materials you want to use. I encourage people not to use too many materials to prevent confusion. Yeah, the contents are the same, but it's just being put together in different ways by different people. But then they are passing across the same information. So to avoid overload, confusion, I would advise that you don't use too many resources. Use 2 to 3 high quality resources depending on your choice and your financial budget. Yeah. So I recommend that for contents, for you to study the contents, you can use Sanders textbook or Kaplan textbook. I use Kaplan during my home time. So those books contain everything you need in relation to the contents. You can use other textbooks. I'm just using those as an example. Yeah. And also for question bank, you can use UWorld NCLEX question bank, or you use Kaplan NCLEX question bank. There are so many. You can choose any other one you feel comfortable with, but don't let it be too many. Then we have some people that are audiovisual learners. There are some YouTube channels where you can see how procedures are being done, and examples of such is Simple Nursing, Nurse Achieve, Marquet. Yeah, if you're an audiovisual learner, those will be very, very helpful to you. And also on the Board of Nursing website, NCSBN website, they have a lot of information that will be helpful to you. They have official topics that you must prepare with. So you can always go to their website to check the list of topics that they recommended there. So also, you have to diagnose yourself. If you are using UWorld, there's something they call UWorld self-assessment, and if you are using Kaplan, there's something they call diagnostic practice test. So now you are not deeply into the reading, but here you have some residual knowledge. You've been a nurse for years, or you are staying in school and all that. So definitely you know something. So try and take that self-assessment test or the diagnostic practice test. What will that do for you? That will help you to diagnose yourself. It will serve as your basic knowledge, like what do you know? And it will point you to your weak subject. It will let you know the content that you need to study more, and it will let you know what kind of questions you are struggling with the most, because there are different question styles in NCLEX. We have something they call select all that applies. We have something they call prioritization question. We have delegation questions. You doing this diagnostic test or self-assessment test will help you know what are your weak areas and what are your strengths in this exam. So after that, you will have to break down the NCLEX content into categories: management of care, safety and infection control, pharmacology, prioritization and delegation, medical surgical. Those are high yield study areas which you have to pay the most attention to. And there are some low yield study area which are not that voluminous, like psychiatry, nursing basics, community health, basic health and promotion. Those are not high yield. Those are not high yield questions, and they are not that voluminous. It's something that you can just do crash reading on. Yeah. So let's go to the study structure. How will you now create your study structure after you've done all this and now you have 6 weeks? How will you be able to navigate yourself to do these things? So I'll say week 1 to week 2, you have to build your foundation. Like, you have to choose the content you really want to focus on. Is it management of care, safety, infection? Choose them put them in categories. So have those high yield areas from your week 1 to week 2. And after studying the content, I will advise you do at least 50 questions per day. This is 1 to 2 weeks, so it depends on you. Some people will read, do the question. Some people will use 1 week to read the content and the second week to do question bank on the content that they just finished reading. So it depends on the way you want to do it or what works for you. But make sure you read the content, and after reading the content, make sure you do question bank related to the content that you have studied. And if you need to watch videos on your weak areas after doing the questions and analyzing everything, if you need to watch videos on your weak areas, don't hesitate to do so, and make notes on pertinent information that you discover during this period. So let's go to week 3 to 4. Week 3 to week 4, this is just a template, it's just an example. You can do pharmacology and all the core systems, the cardiac, renal, neuro, respiratory, endocrine, and don't forget that you still have to do the Q banks. You have to do the Q banks, do the remediation, and make notes and watch videos as you deem fit. You can also do drug review in relation to all the systems that you are studying this week, like all the cardiac medication, all the renal medication, the respiratory medication, endocrine medication. As you are studying the system, you are doing the drug review related to them. And you can also try to do at least 10 select all that apply question during this 3 to 4 weeks period. Yeah, you can do it. It seems to be a whole lot, but you can do it if you put your mind to it. And writing things down and having a plan will actually guide you. We actually make it more easier for you, even if you don't follow the plan 100%. So week 5, what will you do? Week 5, make sure you do a full length practice test. Whether you World Kaplan, Hatcher, or wherever, they have computer adapted tests that simulates NCLEX examination. Depending on the package you purchase, you might have up to 2 or 3. So make sure you do 1 in your week 5. Full length simulating NCLEX exam. And after doing that, make sure you remediate. That will even give you percentile, like it will let you know how you are going to do in the exam. Maybe if you pass so well, it will tell you your percentile, and if you are not really doing well, it will let you know, and that will guide you to know how to adjust your reading again. Analyze all the rationales, identify your weak areas, watch videos if you need to do, and depending on whatever scores you get on that, don't let that one discourage you. Just keep pushing. And your week 6 restudy your weak subjects, review your lab values, review your prioritization and delegation, do questions daily, but you don't have to study contents anymore. Just be doing questions and be answering, be doing remediation, and if you need to listen to Marquet audio again, do so. If you need to watch some videos, make sure you do so. I hope this has been able to help you for to make your study plan. You don't have to follow it 100%, but it's going to guide you on how to create the one that is going to work for you depending on the time that you have left before you write your exam. Thank you so much for listening. Don't forget to like, don't forget to share, and don't forget to comment in the comment section. I will always answer your question. Thank you. Bye.